Imagine yourself as a patient in a hospital room. From blood pressure monitors to IV pumps, there are thousands of dollars of medical equipment surrounding you. But what if I told you that a $10 piece of technology just may be the most important thing in that room? Let me tell you about my favorite patient, Jimmy. During the summer of 2016, he was on our unit often. I frequently cared for him as his nurse and later as his friend. While checking his vital signs upon admission, I noticed that his pulse and his respiratory rate were significantly elevated. "What's up?" I asked him. "Is it the pain?" It was the first of the month and Jimmy was distraught because he hadn't paid his rent before coming to the hospital. He was fumbling around the bed looking for something. "It's my phone," he said. "It's dead. I can't remember my niece's phone number, but I need to call her. I need her to drop off my rent money. What if my landlord evicts me?" You see, at the age of 58, Jimmy was finally able to rent his own apartment for the first time, a place he was thrilled to call home. Having participated in end-of-life conversations between Jimmy and his medical team, I knew it was his hope to be discharged home. "I don't want to die in the hospital," he told me. "I want to die at home." With the mention of eviction, I felt my own heart rate rise. I scoured the unit looking for a cell phone charger that would bring his flip phone back to life, but no luck. Jimmy kept calling me on his call light, asking if I'd found a charger yet, and it consumed my attention the entire shift. It took time away from my other patients and left me feeling frustrated. If only Jimmy could have made that one quick phone call, his niece would have reassured him that the landlord would have the rent money by the end of the day. That one call could have spared him a day full of anxiety. It could have lowered his heart rate and calmed his breathing. But he couldn't make that call because her number was locked inside a dead cell phone. Before COVID, research had proven that patients had better health outcomes when they were able to stay connected to their family members. One study revealed that when patients could connect with their loved ones at any time, they showed a marked decrease in thyroid-stimulating hormone over the course of the hospitalization. This change in hormones resulted in a decrease of cardiovascular complications and lower average blood pressure readings. In addition, there was a measurable decrease in symptoms of anxiety and depression. The COVID pandemic has left patients more isolated than ever. Faced with strict no-visitor policies, how can we ensure that patients can maintain vital connection with their loved ones? Today, our cell phones are our most valuable tools for connection, but they only work when the battery is charged. And as any nurse can tell you, patients rarely remember their cell phone chargers as they rush to get to the hospital. As I watched the COVID pandemic spread across the country this spring, I heard more and more stories of patients all alone in their rooms, feeling terrified and entirely disconnected from the outside world. Jimmy's story flashed through my mind, and I realized there was a simple, tangible way for me to help. I had to get cell phone chargers to patients. I started with a box outside of my apartment with a handwritten plea for neighbors to donate their spare chargers. I collected several over the next few days, but soon realized that I would make a bigger impact if I could buy chargers directly from a wholesaler. I started a donation drive online, and the response was swift. I got in touch with a local electronics distributor, and he agreed to sell me the chargers at cost. I bought out his entire supply and was able to donate hundreds of chargers to hospitals all over the city. Before I knew it, the effort was getting national media coverage. Within days, I was getting requests for chargers from hospitals all over the country. So I recruited friends and family members and former students to help me with this effort. As the team took shape, so did our name, the Charger Squad. Requests kept coming in, and we started to think bigger. How could this effort be truly sustainable? It would need to be more than just donating cell phone chargers to local hospitals. We needed a universal charger that could be installed at the patient's bedside. Fortunately, we found a distributor who's working with us to develop a locking universal charger that will charge any cell phone currently on the market. At the start of this year, the American Hospital Association reported that there were 924,107 hospital beds nationwide. What I envision is a cell phone charger permanently installed at each and every one of them. Think of the impact that would have, not just for patients, but for their family members and loved ones and those caring for them as well. For patients, they could maintain vital connection with their loved ones. This would support their emotional and physiological recovery. For their family and friends, they could stay informed and advocate for their loved one. And as for nurses and other hospital staff, a permanently installed charger would mean an end to the hunt for a spare charger and would ensure that patients had more time to spend with their nurses. This pandemic has laid bare the inequities facing our healthcare system, and it will take extensive long-term effort to solve them. But at a cost of less than $10 a charger, we can act today to transform the hospital experience and improve patient outcomes. This is the inaugural project of my newly founded nonprofit, the Patients First Initiative. Our mission is to develop low-cost, high-impact interventions that improve patient experience. Installing cell phone chargers is just our first step. We are doing everything we can to make sure that anyone who ends up spending a night in the hospital won't be alone, because at their bedside will be a cell phone charger. I urge you to do what you can too. Make more calls. Reach out to someone in the hospital. Lean into your communities and connect. It's good for your health.